Hey guys, welcome back to my channel. If you have not subscribed to my channel yet, please subscribe and don't forget to like and share. This is my first animated video lecture. I hope you will like this. So, let's move on to our new topic which is related to common neuromuscular issue, that is sciatica. In this, we learn some basic intro of sciatica, how it develops, main clues to identify sciatica, sign and symptoms, causes and the risk factors, treatment, mainly focus on physiotherapy treatment. We start with some basic definition of sciatica. Sciatica refers to pain that radiates along the path of the sciatic nerve, which branches from your lower back through your hips and buttock and down each leg. This is a severe condition, and sciatica affect as many as 40% of people during their lives. Is sciatica a disease or symptom? Mostly people, even medical students, confuse a sciatica with a disease or a symptom. So the answer is it's a symptom, it's not a disease. Then we move on to some common questions people mostly asking about sciatica. The number one question is, can sciatica travel in both legs? Yes, commonly it can travel in one leg, but it can rarely travel bilaterally due to some degenerative diseases and disc issues such as disc bulge, disc herniation, disc protrusion, spondylolisthesis, or a disc fracture. The next question is, when sciatica starts? It occurs when herniated disc, bone spur on the spine or nerving of spine, that is spinal stenosis, compressing the part of. The next common question is, can sciatica develop in teenager? Rarely, but yes. The reason is, as kids supporting events become more competitive and the activities more specialized, certain type of injuries causing back pain tend to rise. Teens who tend to punish their spine through gymnastic or extreme sports such as skateboarding, inline skating, and vert biking will frequently land very hard on their feet or buttock. Either way, the force is transmitted to the vertebra, which can result in a vertebral fracture or a damage to the intervertebral disc. These are all the possible causes of developing sciatica in teenager. So we move on to the next question is, at which age sciatica start? Same like teenager question, adult asking about why my back is hurting so much and complaining of pain travel in one leg. The common is a middle age is 30 and most likely to develop between 40 to 50 years of age. Reason is why sciatica develop from 30 to 50 years of age. The main reason is we are working very hard on this stage, such as in adults, lifting heavy loads affects the spine and possibly the cause of early degenerative changes in the spine, which can lead to sciatica. Now we move on toward the important slide of this lecture, causes and risk factor associated with sciatica. First we discuss causes, then we discuss risk factor. The number one cause is herniated disc. A herniated disc is a condition in which the annulus fibrosus outer portion of the vertebral disc is torn, enabling the nucleus inner portion to herniate or extrude through the fiber. The next cause is bone spur, overgrowth of bone, tumors which occur rarely, damage by disease such as diabetes mellitus. Spondylolisthesis. Spondylolisthesis is the forward slippage of one vertebra on other. Piriformis syndrome. Piriformis syndrome is a condition in which the piriformis muscle located in the buttock region spasm and cause buttock pain. The piriformis muscle can irritate the nearby sciatic nerve and cause pain, numbness, and tingling. The next cause is trauma, and the last one is osteoarthritis, which is degenerative joint disease. Now we move on toward the risk factor. The number one risk factor is age. Number two, obesity. Number three, occupation, especially if you are carrying a heavy loads or driving for a long period of time. And the last one, if you are sitting for the prolonged period of time, it can irritate the sciatic nerve. Now we move on towards the treatment options. Number one, which is very best treatment nowadays for the sciatica, is physiotherapy. Number two, medications. In medications we can use non-steroidal anti-inflammatory drugs, oral steroids, anticonvulsant medications such as gabapentin, opioids, analgesics such as tramadol. Number third is massage therapy. Number four is lumbar therapeutic injections, and the last thing is sciatica surgery. Benefits of physiotherapy to treat sciatica. Therapy helps to reduce pain, restore your movement, strengthen your weakened muscles, reduce tension on your back, and improve your quality of life. In next video, I will share some exercises to relieve sciatic pain with picture or maybe with video demonstration and some best home exercises plan. So keep watching my channel and don't forget to like and share. Thank you.